Good morning, everyone, and welcome to Warren County Memorial Library. We are honored today to host the ribbon cutting for the Narcan vending machine, a critical step in increasing access to life-saving resources in our community. At the library, we believe in being more than just a place for books. We are a hub for information, support, and community well-being. This partnership and initiative with Warren County Health Department reflects our shared commitment to public health, safety, and compassion. We thank everyone involved in making this possible, and we look forward to continuing to serve as a safe and supportive space for all. Thank you for being here today.
I first want to thank Tanika for giving the welcome, and I will give the purpose. So I am Dr. Margaret Brake. I'm the Health Director for Warren County Health Department. So I'll start by saying the Warren County Health Department and the Warren County Memorial Library are excited to partner to make free risk reduction supplies such as Naloxone, which is the opioid overdose reversal medicine, Fentanyl, and Xylazine testing strips available to anyone in our community. The overdose rate in Warren County is 15.9 out of 100,000 residents, and that's for 2024, which represents about 3 people who died of an overdose. The estimated overdose ED visit rate for Warren County is 63.7 per 100,000 residents, and this was in 2025. Representing about 12 emergency department visits for overdose. So while Warren County's rate is considered among the low rates in North Carolina and in our surrounding counties, we know that risk reduction and prevention programs can help to lower that rate even further. 1 death from an overdose is too many in Warren County. We are grateful for our partnerships with Warren County government, who is the recipient of opioid settlement funds, the Warren County Sheriff's Office, and the Warren County Emergency Services, who have partnered to increase education of first responders as well as community members on overdose prevention and training on how to administer naloxone. Today's announcement is just another addition to Warren County's toolbox for addressing opioid and substance use addiction. Funding for this program is provided through the HRSA Rural Communities Opioid Response Program, led by the Wilson County Substance Prevention Coalition. So at this time, I would like to introduce Chris Tucker, who is our Emergency Services Director. And Chris is going to talk to you about impact. So while our numbers have been low in Warren County, and we're extremely thankful for that, we have had incidences of overdose and situations where naloxone has proven to be successful in Warren County. So at this time, I will turn it over to Chris.
Hey, good morning. Thank you, Dr. Brake, for that brief introduction, and I'm glad to be here. So over the last 5 years, one of the programs that I have done a lot of work with is actually going out and teaching how to give naloxone. So I'm gonna be very brief, but I want to tell you about a story. So I want you to know this upmost in front. You don't have to be a habitual drug user to overdose on an opioid. It can happen to anybody. So let me tell you this story real quick, and this is where it hits home. Last year, we had a 69-year-old grandma that went in for knee surgery at the local hospital. She went in on a Thursday morning. Everything went perfect. She come home that afternoon around 6 o'clock, come home, and she had 2 siblings that were taking care of her. One was going to take the night shift, one was going to take the day shift. So she come home, everything was lovely. She took her medicines like she was supposed to that night, and the next morning she got up. Her daughter come in and woke her up and give her her medications for that morning, ate breakfast, and physical therapy folks come in. So physical therapy comes in, and it overexerted her. She was hurting so bad, she told her daughter, she said, I need some pain medicine. So her daughter gave her some pain medicine right then, about 9:30. And something happened, she had to leave real quick. So she called the other sibling to come in and say, hey, I've got to go to my job. We've got emergency. Can you come in and stay with mom till I got back? So she did. She come in and the sibling took over. And her mom told her, she said, you know something? I'm ready to eat lunch, but I'm still hurting. So that sibling went ahead and gave her another dose of an opioid. Okay? So this is 3 doses of opioids that she got in like a 3-hour period. So mom ate, so it went and sat in the recliner and everything was lovely. The other sibling come back to take over for the rest of the day. And the sibling noticed that mom was not breathing as good as she was. And it got worse and worse. Their mother suffered from a opioid overdose just accidentally off of 3 pills. So she called 911, emergency service come in, we done an assessment on her and we give her 4 milligrams of Narcan and brought her back. So this can happen to anyone. You don't have to be a habitual drug user to put a needle in your arm, smoke it or whatever. It can happen to any of us. I'm happy to say that today the rate of overdoses from this year has dropped 33% since last year. And as of our last Duke Race Cause meeting that we do for cardiac arrest survival, we have trained approximately 3,500 individuals since the start of this in 2020. So that's 3,500 citizens, private citizens that know how to give Narcan. And we have given over 500 doses of Narcan out in that time frame. So I'm very thankful for those programs, and I think, you know, the statistics show that over distributing this in the last year, 33% reduction in last year. So I'm hoping to see that number maybe go down a little bit more and be higher next year. So I'm grateful for y'all inviting me today. If you want to know how to give Narcan, see me. I'll be more than glad to tell you how to get it and how to receive it and how to make sure you know what you're doing to save a life. Thank you, Dr. Brett.
Thank you, Chris. At this time, I would like to have some of our staff to come up with our county manager, Crystal Smith, for our ribbon cutting and the announcement and launch of our Naloxone vending machine porch box.
If you want to move it in the middle. Omar?
And at this time, I'll have Brittany Harris, who is our health educator at the health department, to introduce the Naloxone porch box to you.
All right, so in our Naloxone porch box, we have inside a video for the opioid response overdose. If you pull it down, it has a video right here that will tell you all the directions of what to do.
First off, let's take a deep breath.
So there's a recording in here. We have some medication lock boxes. We have medication lock pouches. We have Xylazine testing strips as well as fentanyl testing strips. And we have the scoops for the drugs as well, along with information on how to use these testing strips. And Naloxone, we have Naloxone sprays in here and lock and peel bottles. So, and we have directions for each thing right in front.
So we are excited to have this porch box here at the library. It is the first location in Warren County where we will be providing Naloxone, the testing strips, and other products. So I really appreciate Tanika here at the library. We have great partners in Warren County, and I really do appreciate how we all just come together to make things happen. So this is one of many. Chris has also placed Naloxone across the county in AED boxes. So we are really trying to make this accessible to residents. We have trained first responders, our law enforcement officers. Chris have trained them on how to use Naloxone, and we just want everybody in our community to be aware. This is a life-saving opportunity, and we don't know who it could be. As Chris said, it doesn't have to be someone who uses drugs. So we know that it's an opportunity to save lives, to improve health and wellness of our residents here in Warren County. So we do recognize also that with overdose, there are a lot of things that can be attached to it, mental health conditions, having other substance use disorders, and also being homeless. So because of that, we are proud to have partnerships with our local providers. Trillium Health Resources is here with us today to help us navigate the waters with all of the people who may be impacted by opioid and substance use disorders. So I do again want to thank the library, thank all of you for being here, and we look forward to continuing the work here in Warren County. Thank you so much.